Hello and welcome to Understanding Your Options, a COVID-19 vaccine educational town hall. My name is Major Greg Hartshorn, and I am the Divisional Commander for the Salvation Army, serving 28 counties here in Western Pennsylvania. We are honored to be here today with our partners and co-hosts from United Healthcare. This past year has been a challenging year for everyone, but today we're thinking especially of you, the many individuals and families we've served throughout COVID these past 14 months now. There's a lot of information that's out there, and it's easy to get overwhelmed. So our healthcare experts at United Healthcare have taken the time to put together a video resource just for you. We hope it will give you the information you need about life-saving COVID-19 vaccines, where and how to make an appointment to get a vaccine, and provide answers to common questions and concerns we've heard from many of you. You and your families are important to us. Please watch the video and schedule your vaccine as soon as possible. When you get the vaccine, you are taking good care of yourself and showing care to your family and your neighbor. Thank you.
Great, thank you. On behalf of United Healthcare, let me thank the Salvation Army Western PA Division for their continued support and partnership supporting the Western PA community. So wanted to just thank them for their continued support. My name is Corey Coleman. I serve as the Vice President for Community and Strategic Partnerships, and we are really proud to continue to partner with the Salvation Army to help provide resources around managing through the COVID pandemic. We've provided through this forum a number of tools that we really think will help community members, understand the options they have, and also understand the evolving, changing dynamics around COVID-19. And again, from United Healthcare, we are here to help and very, very pleased to again partner with the Salvation Army. I have the pleasure of introducing some of our speakers for today. So let me just very quickly let you know who will be speaking today. We have Stephanie Rex, who's the Director of Marketing and Public Relations for the Salvation Army Western PA Division. We have Dr. Brian Parker, who is the Chief Quality Officer for Alleviating Health Network. We have Dr. Mrna Dahl, who is the Market Chief Medical Officer for both Pennsylvania and Delaware Medicare and Retirement for United Healthcare. And we also have Patricia Canal Duckett, who is the Medicaid and CHIP Community Outreach Manager for United Healthcare Community Plan. Pleased to be here with you all, and we really do hope that this information is helpful as we all manage through the COVID pandemic. At this time, I will hand the presentation over to Dr. Dahl to provide a little bit of an overview around some of the options you have before you.
Hi, and thank you so much, Corey. It's wonderful to be here with all of you. I'm so excited that we have this opportunity to share some good information about COVID vaccine and to share a little bit of, I guess, to boost confidence is really our goal today. And in order to do that, actually, I have a brief video I'd like to start with, and a short slide presentation. And then I do want to invite Dr. Parker to share his wisdom and his expertise. So if you want to go ahead and start the video.
Life's path took a sudden turn for everyone when the pandemic struck. And when it struck us hard. But through the experience, we found ways to change how we work, how we learn, how we celebrate, how we spend time with family, even how we seek care. Thanks to a global effort by biotechnology and pharmaceutical companies, the COVID-19 vaccine is here. The U.S. Food and Drug Administration has authorized for emergency use more than one COVID vaccine, and vaccination is underway. The vaccines were developed to protect people from COVID-19 and to help stop the spread of this dangerous virus. But is the vaccine safe? The answer is yes. The U.S. Vaccine Safety System validated the safety of the COVID-19 vaccines. You cannot get the COVID-19 virus from the vaccine, This is because the vaccines do not contain the live virus itself. They are designed to teach the body to make antibodies that find and fight the COVID-19 virus. Even if you've already had COVID-19, regardless of how mild or severe, experts know that immunity subsides after infection, so they strongly recommend getting the vaccine. And it won't cost you anything. You will have a $0 cost share on FDA-authorized COVID-19 vaccines. Vaccine distribution strategy is based on the CDC recommendations and varies by state. Now is the time. Getting the vaccine not only lowers your chances of getting COVID-19, it also helps protect our healthcare system and those working within it so they can provide the care we need when we need it. In addition to continuing to follow best practices, masking, hand washing, keeping surfaces clean, and physical distancing, getting the COVID-19 vaccine can help stop the spread of the virus. Learn more about how you can take the next step.
Thank you for sharing that, Stephanie. And I just want to share a couple of facts before we move into our conversation. We want to keep this pretty conversational and make sure also that we can answer some of your questions as well. Okay, so here's just a few important facts about COVID-19 vaccine safety. You know, there are a lot of myths out there. There's some misinformation, and I thought rather than reinforce those myths and misinformation, I wanted to just focus on 4 facts before we turned to Dr. Parker. So the first fact, everyone should know, no corners were cut in the development of the COVID-19 vaccines. To this end, scientists built on 20 years of research into other coronavirus diseases, such as you may have heard of MERS and SARS. They applied findings from cancer research and other fields to the new vaccines. Researchers and leaders from universities, private industry, nonprofit groups, and the US government worked together on the common goal. And due to the added urgency and extra funding, scientists developing new COVID-19 vaccines combined several steps at the same time. Fact number 2, serious reactions to the COVID-19 vaccines are rare. So most people who've had the COVID-19 vaccine experience only mild side effects. Common ones include a sore arm, that's one I had, mild headache or fatigue that lasts less than a day, according to the CDC. In rare cases, people had a severe allergic reaction within 15 minutes of getting the vaccine. That's why you'll be watched for 15 to 30 minutes after you get your COVID-19 vaccine to make sure you're okay. Fact number 3, almost everyone should get the vaccine. The CDC recommends that almost everyone get the vaccine when they're eligible. It's very important for people with diabetes, high blood pressure, and other health issues to get the vaccine. This is because the risk of becoming very sick from COVID-19 is much greater for those with chronic health problems. There are a few groups of people who should hold off, including children and those with a known allergy to an ingredient in the vaccine. When in doubt, I would say talk to your primary care provider. And lastly, trial participants were racially diverse. The breakdown of races and ethnicities in the clinical trials was designed to reflect the US population. These trials showed that COVID-19 vaccines are as safe and effective for people of color as they are for white populations. This is important to know because CDC data shows that COVID-19 has caused serious illness and death among Black Americans and other people of color at higher rates than white Americans. And again, I would like to thank all of you and introduce Dr. Brian Parker. He is, again, a local expert on COVID vaccine and has been instrumental in the efforts to bring awareness about COVID vaccine and get people in and get shots in arms. So Dr. Parker, I know you have a lot you wanted to share as well.
Yeah, very
Thanks.
much, Dr. Dahl, and thanks very much to the Salvation Army for putting this together to share with folks across Western PA. So, what I'd like to do is spend a little bit of time talking a little bit about the vaccines themselves, so folks have an understanding a little bit about the science behind them and how they work, and to give some additional thoughts around the safety that they provide, the development that they went through, and again to amplify what Dr. Dahl said around no corners were cut, and that this is proven and known technology that was used. So the first vaccine that came on to the marketplace here at the end of 2020, as well as immediately after that, was both Pfizer and Moderna. And those two vaccines use very different technology from other vaccines that have been put out into the marketplace for years. And they're referred to as mRNA vaccines. And what they do is they take advantage of your body's machinery that does this work every day to protect you from diseases, and basically give your body the opportunity to be exposed to the spike protein that sits on the outside of the coronavirus. And that's why it's called a coronavirus in the first place, is those spikes look like a crown, and corona is Latin for crown. So the outside of that virus is covered with those proteins, and that's the way they enter into your cells, in your nose and in the back of your throat when you're exposed to someone who has COVID-19. And so these two vaccines take that messenger RNA, that mRNA, that is a template that your body uses every day to make protein. They encoded it with the information to make the spike protein and put it into a globule of fat, so that when it's injected into your arm, that fat goes right across the membranes of your cells, specifically your white blood cells, to get inside and release that messenger RNA. And essentially it lands on the factory floor of your cell, of that white blood cell, and a protein comes along called reverse transcriptase, and it simply latches onto one end of it and starts to take the building blocks of proteins inside your cell and makes the spike protein, takes it to the surface of the cell and proudly displays it outside. And your body immediately recognizes that that spike doesn't belong on that cell and starts to work on creating antibodies. And so what happens is you get the benefit of your immune response to make antibodies against the thing that is most distinguishable about the coronavirus. And at the same time, you don't have to get COVID-19. And within about 2 weeks, all of the ingredients that are part of that vaccine are completely recycled in your body, and there's nothing left. So it has nothing to do with your chromosomes. It has nothing to do with your fertility. It has nothing to do with changing your genetic makeup in any way. All it really does is make a bunch of the spike proteins and then gets recycled. When you talk about the Johnson & Johnson vaccine or the AstraZeneca vaccine, which is not approved in this country, they use a more traditional technology. They use what's called attenuated or deactivated virus vectors. That's a fancy way of saying that they use a virus, and both of them use cold viruses, and they make it so that the information that is normally used by those viruses to make more of them, to replicate or duplicate, is removed. So the virus is used to get the contents to make the spike protein again, just like the Pfizer and Moderna vaccines, but instead the virus can't make more of itself. So it delivers the package to the cell to make the spike protein in a similar fashion as the mRNA vaccines, but no virus is actually made. And because it's not the coronavirus, they're regular cold viruses that have been deactivated, again, you don't get any disease. And as a result, that same machinery that's used to make those vaccines gets recycled in a couple of weeks in your body as well. So there's really no remnants left over. And again, it has nothing to do with changing anything with your chromosomes or your genetic makeup. As Dr. Dahl mentioned before, the side effects of the vaccine are normal. sore arm, fatigue, feeling tired, headache, maybe a low-grade fever. Not everyone who gets the vaccine gets those side effects. And if you don't get those side effects, it's not a sign that the vaccine isn't working. When you have millions and millions of people that are being given these vaccines, everybody's body reacts a little bit differently to them. But not getting any side effects doesn't mean that you didn't get the vaccine or it's not doing its job. But the vast majority of those side effects are gone within 24 to 36 hours. The important thing to recognize about all of these vaccines is that they're very, very effective at preventing disease and helping to prevent the spread of COVID-19. What's really important to recognize is that a lot of people get hung up on the math around, well, they said the Pfizer vaccine was 94% effective, but the J&J vaccine is only 72. So which vaccine should I get? And the answer to that is you should get the vaccine that you can get, the one that you're offered and the one that gives you the ability to get it as soon as possible. Because the numbers that they're talking about really aren't important when you put it in context of the flu vaccine. So every year, the United States and the CDC goes through a flu campaign. It starts usually in September. And the flu vaccine is anywhere between 40 to 60% effective. And what does that mean? It means that if I give it to 100 people on a year where the flu vaccine is less effective, it means 40 of those people won't get the flu. They won't get sick and they won't know, even if they get exposed, that they're going to get terribly sick. So might have very mild or no symptoms at all. The other 60 people of those 100 are going to get mild to moderate symptoms at worst, but it's going to keep them out of the hospital and the emergency room and potentially even the intensive care unit, especially for those folks who are at high risk for flu disease that can impact them because they have other diseases as well. So, and that keeps them out of the hospital. The same thing is true for these vaccines for the coronavirus. The difference is that they're more effective than the flu vaccine. So all of them are very, very effective at making sure that you don't get severe disease, you don't end up in the emergency room, you don't end up in the hospital, and you don't die as a result of getting COVID-19. And all of them are very equally effective at preventing that. And that's incredibly important around ensuring that we don't have folks who get severe disease. So getting the vaccine is incredibly important around avoiding that from happening. So what about the variants and the strains that we hear about? There's some new variants and strains that have popped up in the US, but the ones that have made the news are really from the United Kingdom, from South Africa, and from Brazil. So the one from the UK was discovered late last fall, early winter, became the predominant coronavirus in the United Kingdom, and now represents probably at this time about 40% or so of the cases in the United States. It's definitely more transmissible, probably up to 50%, meaning that it's more effective at moving from one person to another to spread disease. And there's some evidence that it may cause more severe disease in certain folks who are at higher risk for getting ill. The issue with that particular strain is that it's probably responsible for the outbreaks in some of the places that we saw that were locked down the tightest over the winter, Michigan being one of those locations. So you're seeing significant spread in certain places of the country, whereas other locations like the Sun Belt in the Southeast and the Southwest, we're not seeing that sort of activity from that virus at all. The other strain that was of major concern is the one from South Africa. It's endemic there, which means it represents 90% or more of the infections that are occurring in South Africa. There's very little activity of that virus outside of South Africa, other than it's been seen in lots of countries around the world, but it isn't a predominant cause of COVID-19 right now outside of that continent. And then lastly, there's another strain from the Amazon basin in Brazil that was first seen actually in Japan, and they believe it may be responsible for some folks who had mild infection previously to be reinfected again. But again, that's predominantly been seen only in Brazil and in some other places in South America, and does not make up a significant proportion of disease in the United States. What's important to recognize is that all of the vaccines that I talked about that have been emergency use authorized by the FDA here in the US are effective against all those strains or variants. So if you're thinking, well, gee, why bother get vaccinated? There's all these other strains out there that they may not be effective against. That actually is not the case. And so thinking that that would be a good strategy to wait for another vaccine to come out is probably not the best strategy. Getting vaccinated now reduces your chance of getting anything here in this country or any strain that gets introduced from outside this country as a result of travel. And really the name of the game in terms of getting the vaccine is about not only reducing your risk from getting sick, but reducing the risk of you spreading it to someone else. And unfortunately, we probably all know somebody that would be at risk, that if they got the infection, it would make them sick or at higher risk for complications. So reducing your chances of spreading it to someone else by being vaccinated, and quite frankly, not giving the virus another chance to spread to someone else, to mutate and change and create another variant, is an important strategy in reducing the pandemic. So with that, Dr. Dahl and Stephanie, I think I'm going to stop and maybe we can start to look at some of the questions that have been submitted.
I just wanted to say that was an excellent overview, and I really appreciate how Dr. Parker broke it down into little particles, literally, for us. What I'm thinking about mostly now is there was such a shortage of a vaccine initially, and people were clamoring to get it. And now it seems we have a lot of vaccine and people might still be hesitant to take the vaccine. I'm just wondering, Dr. Parker, you said very nicely, it's not just for you, but it's also for that person you might be near who might know somebody who is at higher risk. What else would you say to someone who's, still kind of on the fence about taking the vaccine?
Yeah, I guess there's a couple of things. It's obviously personal choice. It's not something that's been mandated by the government or for too many places. We've heard about a handful of universities talking about mandating it for students to come back on campus next fall. But I think at the end of the day, there's your personal responsibility, there's your family sort of responsibility, and then there's the social responsibility around vaccination. And I think when people start to look at it and say, I'm doing it just for me, when you look at the way public health deals with disease and the spread of disease, this isn't just an individual's problem. This is society's problem, and unfortunately, it's become a global problem. And returning back to that old normal that we all would like to be back to, with no masks and no social distancing, and still hopefully washing our hands and doing all the things our mothers still told us to do when we were younger, is still going to be important. But I think at the end of the day, we don't want to have to go through this every year. And the best way to do that is to, take that accountability and responsibility for your neighborhood or your neighbors and your family, and to do this as a group, because otherwise, if we don't move as close as we possibly can to that herd immunity, it becomes a question of having this around all the time. And, people have talked about, well, could this become an annual flu vaccine or something like that, where you have to do it every year? Are we going to get boosters? And I think the reality is that might be the near-term solution, but the more people vaccinate and create dead ends for the virus to not be able to go anywhere because someone's either been infected and vaccinated or has just been vaccinated and has good immunity, means that the virus doesn't have anywhere to go and it has to keep knocking on doors. And the way to get rid of a virus, quite frankly, is viruses don't have brains. They don't have the ability to make choices. It's random mutation that drives them to either become more deadly or more transmissible, or frankly, they create their own dead end because they make a mistake genetically in replicating themselves, and it means they can't do it anymore, and that strain or variant dies out. What we would like to do is end up with more of the latter, creating more of those opportunities for the virus to just not have a place to go and burn itself out, than try and figure out what's our public health strategy going to be for next fall or the following spring. So I really think taking all of that into account and being armed with some of this objective information, I think is important for folks to be able to make those choices.
What I hear you say too is let's do this together and let's do it now rather than postponing it for the fall or years to come. So thank you for that.
Yeah, looking at a little bit too. And, we're 4.5 months into vaccinations. If you look at the middle of December is when, Pfizer first started being delivered. And I liken the adoption of this a lot to folks when the first, Apple iPhones came out. And, it was that decision to say, do I make the move from my BlackBerry or my flip phone to this new technology? And what you saw was early adopters, middle adopters, and late adopters. And so when you looked at when supply of the vaccine was low, we had lots of early adopters, including high-risk individuals that were identified by the CDC, including the elderly, that everybody wanted the vaccine, but not everybody could get the vaccine. And now we've seen, as we've moved away from the higher risk folks into the general population, the general adult population, you've got a lot of middle adopters who are coming forward. But now we're seeing supply outstripping demand. And those late adopters that are sitting on the fence are the folks that we really need to have come forward, and not only come forward for themselves, but for the other late adopters they may know, and say, let's do the right thing. It looks like after 130 million people have done this, it looks like it's a pretty good idea. And it means maybe we'll be able to get back to that new normal sooner rather than later.
Patricia, did you want to say anything next?
Thank you so much, Maria. Yes, I do. We will be presenting on telehealth options offered by United Healthcare. I'm going to go ahead and share my screen now. Since March of 2020, we have seen a rapid increase in telehealth services due to the global pandemic. Pre-COVID, we had about 261 members utilize telehealth for their PCP visits. That quickly increased to 41,222 members from March to December of 2020. Telehealth is virtual visits that you can do from the comfort of your home. We want to encourage members to utilize telehealth for visits such as cold, flu, allergies, and other non-emergent visits. Telehealth offers many benefits. You can chat with your medical provider over the phone or video, get medications prescribed, and sent to your pharmacy of choice, and also get advice and questions answered. Separate from telehealth, United Healthcare also offers Nurseline, which is a platform that allows you to get more information about symptoms or conditions, understand treatment options, and assistance with where to access care. In addition to Nurseline, United Healthcare also offers Doctor Chat. This is a platform that allows you to connect with a physician on the Doctor Chat app. This app is available to all United Healthcare members at no cost. This app allows you to connect with the doctor whenever and wherever. We suggest using this also as a for non-emergent situations. These three virtual options allow you to get the medical attention that you need. If you have a non-emergent situation, we suggest utilizing one of the three virtual options that are available to you.
Before we get to our question and answer portion regarding COVID-19 vaccines, the Salvation Army will now take a few minutes to share the services available to you in Western Pennsylvania.
Hello, I am Lauren Fair, the Divisional Social Services Director for the Salvation Army in Western Pennsylvania. I'm going to share information about community-based resources available to you from the Salvation Army. The Salvation Army has a presence in every zip code throughout Western Pennsylvania. Our services are tailored to each community, so services vary from location to location as we strive to meet needs specific to your community. We develop local programs designed to offer immediate relief, short-term care, and long-term growth in the areas that will best benefit the community. To find the location closest to you, please visit salvationarmywpa.org and select locations at the top of the page. While we offer a vast array of programs and services, I am going to touch on the main service categories in Western Pennsylvania. Number 1, Alleviating Hunger. Food assistance is available from every location and ranges from emergency food pantry assistance to soup kitchen meals to backpack feeding programs for children. Number 2, basic needs assistance in the form of clothing, utility, and rent assistance is available to help households achieve stability. Number 3, teaching kids. We offer character building programs, summer camp opportunities, sports activities, music education, after-school programs, mentorship, and more for children. The Salvation Army's Camp Allegheny in Elwood City provides an overnight camp experience, complete with swimming, sports, nature center, petting zoo, campfires, and more. Number 4, we support older adults. We offer social and enriching groups for older adults to build community and to heal the mind, body, and soul in every stage of life. Number 5, disaster services. You probably saw us throughout the pandemic. We deploy services for those most impacted disasters with the goal of helping households return to a pre-disaster state. Our disaster services include mass feeding initiatives for the community and first responders, as well as clothing assistance for fire victims. Number 6, brightening the holidays for families. We provide food and gift assistance to families in need, as well as winter gear for children and older adults through our Angel Tree, Adopt a Family, and Project Bundle Up efforts. Number 7, giving hope to families. Our Pathway of Hope initiative provides long-term case management and support to empower families and address root causes preventing them from becoming more self-sufficient. Number 8, combating addiction. Our Harbor Light facility in Pittsburgh and our adult rehabilitation centers in Altoona, Erie, and Pittsburgh provide housing, food, counseling, community, and employment as we work to treat the symptoms and ultimately the root causes of prolonged alcohol and drug dependence. Remember that the Salvation Army has a presence in every zip code throughout Western Pennsylvania. So if we do not have the service you need, we would love to connect you to a partner organization that does. To find the Salvation Army location closest to you, please visit salvationarmywpa.org and select locations at the top of the page. We look forward to serving you.
So now we'll get back to the questions that have been submitted by many of the people throughout the Western PA region who are receiving services from the Salvation Army. Our officers and our social workers collected these questions, and as Dr. Parker and Dr. Dahl have been presenting, I've been kind of checking off questions that have already been answered. So thank you so much for that. So as I ask the questions that remain, just feel free to jump in with your answers. Right now, are there long-term risks that we know of regarding the vaccines?
Yeah, so in terms of long-term risk for the technology, no, not really. For these particular vaccines, the part of the requirements by the FDA is that the original trial enrollees, that they were volunteers to participate for all of these manufacturers, would continue to be followed. And part of the reason is to look for those long-term effects. 2 is to look for how long does immunity last in terms of what's referred to as serologic immunity, which means they'll continue to do blood draws on these individuals to measure what are called antibody titers. Essentially, how much antibody is left circulating in your bloodstream as time goes by after that round of vaccinations has occurred. And so they're at the 6-month mark for a lot of those individuals where the trials ended last fall and very early winter as they applied for that emergency use authorization. And so already we're seeing 6 months worth of data, no significant issues in terms of safety, very robust immunity or immune levels in terms of the antibodies being present, which means now we're looking out saying, wow, we've probably got good vaccine immunity as determined by blood or serology for at least a year, maybe as long as 2 years before you would see that drop off. That being said, just because you can't measure antibodies to a particular disease in your bloodstream doesn't mean you're not protected. And the reason why that is you have a particular type of immune cell in your body called a memory cell. And that memory B cell specifically was created to make those antibodies for that particular virus or bacteria or whatever the disease is. But your body doesn't spend energy on making all those antibodies to all the things you've been exposed to over time. You would be on complete overload for every cold you ever had in your life as you've gotten older to just keep making random antibodies. So your body basically has a library of a place where cells sit and wait to be called back into action again when that disease reappears. So it's only one part of the puzzle to measure the antibodies, but assuming that you had a good response, it means you probably have one of those B cell books in your library as part of your defense mechanism should you be exposed somewhere down the road again to either the original or one of these variants of the coronavirus.
Thank you. The next question has to do with how many times will people have to get vaccinated again? And do you think there will be boosters? What information do we have about that right now?
So both Pfizer and Moderna have come forward and said that they believe a booster will probably be necessary. It's not necessarily based on what we just discussed a minute ago around your immune system not being able to recognize or produce a good response, say 1.5 years or 2 years from now as a result of being exposed. What it has to do more with is because the mRNA vaccines are completely engineered, we're not using a virus as the transport vehicle to get that material into your cells to make the spike protein. They have a lot more latitude to engineer the vaccine to match things that are real threats to us going forward. So they will likely make the boosters to represent the South African strain, maybe the Brazilian strain, and an additional variant that they've seen in the UK strain, so that instead of just saying, here's the shot you got 1 year or 1.5 years ago, and it's the exact same one, it's going to get engineered to make sure you get the same immunity you got before, plus a lot extra to keep you safe, because we know people are going to travel again. International travel is going to happen. That's how you move things around the globe very quickly. So it's going to be that extra insurance card to make sure that you're protected against some of these variants as we move forward. How long we need to do that is still, I think, to be determined. You should also know that the same manufacturers are looking at combining a flu and COVID-19 vaccine together for the fall, so that you wouldn't have to go to the CVS twice, because a lot of times they may not want to give you 2 vaccinations at the same time, but they're looking at that formulation and looking at the strains for the predictions for 2021, 2022 to see whether or not they'd be able to create a single shot, but give you basically the immunity that you would need going forward for both, because we didn't have a flu season this year. It gives you a good sense of what happens when you have the social distancing, the hand washing. Flu is clearly not as transmissible as the coronavirus and COVID-19. And so what we're looking at, and we want to make sure we're prepared for in the fall, is another good flu campaign around vaccination for that, and then getting as many folks vaccinated for COVID-19. And from our perspective, the stance that we took last year at AHN was, let's take flu off the table. And the reason why is because when folks are coming to the hospital and we don't know what you have, we have to test for all those. We have to test for the flu, we have to test for COVID. There's plenty of other things. We may have to test for bacterial pneumonia to determine if that's a cause. And so if we know you've already had the flu vaccine and you've had the COVID vaccine, but you come to the hospital with a respiratory problem, it helps us sort things out a lot quicker in terms of both testing and getting you the right kind of treatment. So it benefits folks in many, many ways, especially those who have other diseases that put them at risk, as Dr. Dahl said earlier.
Thank you. Dr. Dahl, do you have anything to add right now?
Just that it's really important to get your vaccine if you can. And there were some questions that came up that were sort of, I have diabetes, I have heart conditions. Should I get the vaccine or will it be more harmful? And I just want to make sure people hear very clearly that having the underlying diabetes and high blood pressure and other health conditions puts you at greater risk for getting sicker if you do catch the COVID-19 virus. So you're even a better candidate for getting the vaccine. As Dr. Parker said, the virus, you won't catch the virus from the vaccine. And in fact, you'll train your cells to be a warrior in your immune system. So that's all I wanted to add.
Thank you. And one last question from our clients that I wanted to address in the next minute or so. Can you talk about children and the COVID vaccine? I know there's a certain age limit right now for vaccines. Do you anticipate that will change? Can you kind of get into that topic for a moment?
Sure. So I think one thing it's important to recognize that in the US, we have about 250 million adults. And of the 330 million people who live in the country, the other 80 million are children. So right now, as a country, we're just over 50% of the adult population being vaccinated. So that's about 125 million people or so. And so I would expect that when children's vaccinations begin, we'll at least get a similar result of somewhere around 40 million children being vaccinated. But it's important to recognize that we're working our way backwards from the ages that are approved in the adult population. So Moderna is approved for ages 16 and above, and Pfizer and the Johnson & Johnson or Janssen vaccine are approved for ages 18 and above. Pfizer already has their safety data and is planning to submit it to the FDA for ages 12 to 17. Since it's 18 and above is approved for them. Moderna is not far behind, and they'll be looking at that ages group 12 to 15 as their first take. So really they're breaking the childhood groups into what the pediatricians basically call, you've got your adolescents, your teenagers, their pre-adolescents, then you're going to have your elementary age children, you're going to have those toddlers and infants and newborns. And so they're working their way backwards from the adult population into the child populations. What they have found so far is that the safety profiles are excellent. The effectiveness of the vaccine creating an immune response in children is important. And I think what we have to recognize is that what's changed from last spring and last summer and into the fall of 2020 is that the predominant cases in the United States were in elderly adults, where probably about 60% of the deaths occurred in those ages 60 or 65 and above. What we're seeing now in this country is that 25% of the cases are in children. And originally the CDC was very optimistic in saying they didn't believe that children were a major source of transmission in the community. And that was true last fall. What has happened though is we have enough changes in the virus and the strains that we now are seeing some children getting sick. We are seeing more children transmitting the virus at school and through the communities. And so we've had, a rash of cases and severity of illness that was predominantly in the elderly. And now we're seeing that demographic change. And so it's going to be important that as each one of these age groups gets approved, that we have the infrastructure, whether it's through the school systems, through vaccination clinics, or through the healthcare system itself, even if it's at the pediatrician's office, that we have the ability for those kids to get vaccinated in whatever forum makes the most sense, so that the schools don't become a source again in the fall of a place to spread the virus back out into the adult community, because the kids are going to come home from school, and if mom and dad chose not to get vaccinated, that's going to be the vehicle that gets mom and dad sick.
And if mom and dad get sick, so might grandma or grandpa if they're nearby. So yeah, but hopefully they've been vaccinated. That sounds like a lot of good news for going back to school in the fall.
Yeah, I wouldn't be surprised if by the time we get to August and early September that we're well into the middle school, if not the late elementary school ages of children to be eligible for vaccination.
Let me thank all of our speakers today who took some time just to share some really helpful information. So one, on behalf of United Healthcare, want to thank Dr. Parker for providing some really, I think, helpful information that I think hopefully everyone who has access to the internet is able to both download and take advantage of the information being provided. So wanted to thank you again, Dr. Parker, for your insight and expertise. Also want to thank Dr. Dahl for her leadership, really helping to pull together this virtual town hall meeting. And of course, our partners at Salvation Army, Stephanie, thank you for helping to really pull all of this together. Really important work for all of the community stakeholders that we serve. I want to thank Patty for providing some great insights around some additional options we want to make sure community members are aware that they have at their disposal. So thank you all for both the time and commitment to support the community as we manage through the COVID pandemic, and for the listeners and viewers of the video. We hope that you find some really helpful factual information around the COVID pandemic and the very real options that you have at your disposal. But on behalf of United Healthcare, again, thank you very much for your time and attention.